Everyone. My name is Jessica Peterson, and I am a substance abuse and mental health therapist for the Harbor Beach Community Hospital. I want to thank you for including Susan and I for today's presentation, and I'm so sorry that I wasn't able to make it. I'm currently quarantined in my house, so this is our best way that we could feel you could get the information still. So I am a therapist here at the hospital. I provide outpatient therapy for mental health and co-occurring disorders, so mental health and substance abuse. And today I wanted to talk a little bit about depression. So depression is a big word for there's many different disorders underneath of it. We're just going to kind of touch some of the basics. And I included 4 handouts with Susan to bring with her that talks about general coping skills that talks about, and coping skills is what we call like, how do I take care of this? How do I deal with the depression or the sadness? So we have a handout for coping skills. We have a handout that just gives you a representation of the cycle that a depressive episode can go through. We have, I included a handout that talks about supporting someone with depression because as I talk, you may not see the signs in yourself or symptoms, but you may say, oh, that sounds like so and so is going through, or somebody I love is going through. So I included talking to your loved one about depression. And then the last handout is just some basic facts, like what we'll take care of today about depression. So, and I apologize because I would have loved, again, I apologize because I would have loved a question and answer portion, but I'll try to cover depression as broad as I can in as amount of time I have, and we'll go from there. I believe Susan will also bring my phone number with her, so she can also give that, and anybody's welcome to call me if they have any questions about the presentation today. So, depression is actually currently the worldwide leader for disability. In the whole world, depression is at the top of that as a cause of disability. It's a very complex disorder. Like I said, it involves many systems of the body, including our immune system. So a lot of the times, scientists are still figuring out causes and correlations of depression. They're still doing a lot of research and what better treatment that can there can be. So this is some of the stuff they do know. One of the biggest trademarks of depression is that it turns your thinking relentlessly negative. So depression can actually distort your thinking, which then spirals and furthers the depressed mood. So, what are some symptoms then of depression? So, some common symptoms, I'll tell you in a second, but I also want you to know that this is different than grieving or feeling the blues because these symptoms, while you know you don't have to have all of them, these symptoms have to be present for at least 2 weeks consistently. And that's what we would consider like a depressive episode would be anywhere from that 2 weeks to months or years. But they have to be going for at least 2 weeks. So some of the symptoms are feelings of sadness, emptiness, or hopelessness, irritability, angry outburst, or a low frustration tolerance, sleeping difficulties. So either not sleeping enough, not or sleeping too much. Excuse me. A loss of interest or pleasure in doing things you normally would have liked to do. So hobbies or even just general housekeeping. It feels more forced than normal for you. Fatigue nearly every day. Feelings of worthlessness. Diminished concentration, sometimes even physical pain that can't be explained elsewise, so headaches or back pain. And some people can experience reoccurring thoughts of death. And as far as like risk for depression, we could talk about that for quite a while, but I wanted to kind of hit the top three. So circumstances, so environmental, so the poverty, unemployment, social isolation, and stressful life events. A family history of depression, they have found that depression is a genetic can be a genetic condition. and then regular drug or alcohol use. And in the next couple slides, I'll talk about coping skills, but I'll come back to addiction and depression in the last part of the presentation. So, cycle. So, what are the stages of depression? So, we have for addiction, we have the stages of change, right? For depression, there's also I would call it not like the stage or the steps, but I would call it more of a cycle. And you can see that by the handout that I gave you. So it first starts with some kind of life stressor. So a stressor can be a situation that causes strain or hardship. They may be short-term stressors, they may be long-term stressors. So we start with the stressor, and then the thoughts come. So what did I say about depression and a hallmark symptom of depression being that negative thinking? So we have our stressor, then we have the thoughts that are often exaggerated or irrational, but some of those thoughts may be like, I'm not good at anything, or I need to be perfect. So it's that exaggerated portion of that, those thoughts, but we start feeling them then, and that's the next step. So we think we have the stressor, we think these thoughts, most of the time negative, especially to do with depression, then we have these feelings. So the way a person thinks about something has a major impact on how they will feel. So our thoughts influence our feelings, and our feelings can influence our thoughts, vice versa. So as you can see, we start going, we have these stressors, we have these thoughts, we have these feelings, and then it becomes part of us, right? Then we start having some of these physical symptoms, like your body is trying to tell you, like, we're not dealing with the stressor well. So you can have more fatigue, sleep problems, the long list of symptoms that we covered before. And then we have the stressor itself, which I talked about. It can be alcohol, it can be drugs, it can be poverty, unemployment, it can be the loss of a loved one too. I don't want to diminish that. Um, so we have this stressor, then we have these horrible negative thoughts that we can't we can't get ourselves out of. So then we have these feelings, and then we're having these physical symptoms. So now we're actually responding to it. So we may respond to this then by further isolating ourselves, neglecting our daily tasks, turning to drugs or alcohol because you want to numb those feelings that you're having. And so then it just spirals. And that's what we call this spiral downwards, because then it perpetrates all the other feelings that you were having. It makes the negative feelings even stronger. So that is just a little bit of the cycle of depression. So, talking about like common consequences of depression. So, we already talked about the isolation factor. So, part of our behavioral response is to further isolate from people, and that is shown not to help. It weakens our immune system. Again, we have alcohol or drug use, which comes with its own myriad of consequences, or could be, and then it interferes with our sleep. So then then the focus and concentration factor is even worse. Again, just imagine a tornado. It's picking up and kind of slowly, though, taking off these areas of your life. So, great. Now we have these symptoms. We are feeling this way. What? Now what? Um, I always advise people, if they trust their primary care provider, talk to them about it. Um, I'm not saying like talk to them because I'm not pushing any agenda for medication, but I'm just saying talk to them. They have the resources to direct you. If you don't feel comfortable, I am including my phone number on here. Reach out. I do therapy here, and it doesn't even have to be you coming to see me, but let's get you to where you can talk about this with someone. But here I'm going to share with you some common coping skills. Again, those coping skills are what we call just basic daily skills used to prevent a relapse of depressive symptoms, or to prevent the relapse of prevention symptoms of depression symptoms. So we use something called behavioral activation. So as we talked about, depression can, sap that energy. So behavioral activation is basically doing the opposite of what you want to do with depression. So this is getting out there and exercising, walking, going for a bike ride. This is socializing. And with COVID, that makes things a little bit difficult, but this is sending that text to a friend, sending that message, calling a loved one that you haven't talked to in a while. This is is a lot harder than it actually sounds, because you're having to go against what you're feeling like doing. Like, you want to isolate. Well, now I'm talking about, you see how I'm talking about, okay, well, we'll push you to exercise and to socialize. It's very hard. And that's why I always suggest talking to someone while you're going through these steps. So we have then, like doing our responsibilities around the house, or playing with a pet, um, taking a shower. Some of these things, taking a shower, brushing teeth, with someone with depression that has increased to severity level, that, no joke, this is a really hard task. So doing some of these little things can really help. And then you'll see, you know, when I talked about these tasks seeming easy, but not if you're in a depressive episode, they seem really hard. I want you to start off really small. If it's just like, I'm going to take 10 steps out my door today, that's awesome. That is great. Make a plan, make goals, set an alarm clock, and try to include some of these tasks, or not even tasks, like some of these skills, into your daily life. Social support, again, very important in any way you can get it. Now you're meeting in a group today, which is awesome. COVID has really impacted the way we treat depression right now, because it is a very isolating kind of event. So I'm very happy that you're meeting today, but finding ways to reach out any way you can. So if that's using your phone, if that's using any sort of technology, heck, even writing a letter, reach out to someone. This is your sign right now to reach out to someone that you've been thinking about. So social support. Then we have addressing the negative thinking. So this again, I'm trying not to be preachy, but this again is why I'm saying this is really helpful to work through with someone, because someone like I can point out some of the negative thinking traps. We have a whole list, but I can point out some of those traps that you may not know otherwise, or because it's easier to point out when it's sitting across from you than when it's inside. So because that negative thinking is such a defining feature of depression, we minimize then like the positive experiences while we're in a depressive episode. So gratitude can really help. I think on that handout they talk about 3 good things, listing 3 good things, and I know that in recovery from substance use or abuse, they talk a lot about gratitude also. It is actually scientifically proven to help. We use something called mindfulness, so paying attention to the present moment. And again, I'm not going to go too far in detail because the sheet does, and I only have so much time. But mindfulness, being present in the moment, taking it one day at a time, can really help reduce the rumination and worry that often accompanies the negative thoughts. Um, and then I told you I promised I would talk about depression and addiction more. Um, no surprise, substance abuse and use is common among people battling a depressive disorder, because alcohol is a central nervous system depressant. The use of alcohol during a depressive episode or before can trigger depression symptoms like sadness and hopelessness, and often kind of intertwine. An addiction can intertwine with depression, and sometimes it's hard to say what came first. But a lot of times, someone who is using any kind of substance is trying to numb some of these feelings. I feel like I don't give them enough justice, the feelings, because we're only able to talk about it in forms of charts and cycles and things as such. But to feel to be in a depressive episode and to feel this negative, almost this the dark shadow over you, it's tiring. It's scary. And so you can see why someone would want to try to numb out the noise, numb out this feeling with either using drugs or alcohol. And so that's why we say, I think they say now 1 in 4 persons who's depressed has an addiction problem. So 1/4, I think that's the latest statistic. 1/4 of a person who, and again, we don't know if that's the chicken or the egg kind of situation, if the person was depressed and then they became addicted, or they were addicted and then the depression came. It's really hard to say unless you're sitting down and analyzing that person. But when a person has both depression and addiction, we call that a dual diagnosis, or I believe, as you heard me say at the beginning of the presentation, a co-occurring disorder. Um, that is something that we see co-occurring quite a bit. And I believe I already touched on where to go for help if any of these symptoms are resonating with you, or if you take my handouts home and you're just looking at that and thinking, something doesn't feel right with me. I don't know what it is or anything of that nature. Please reach out. Again, if it's not with me, reach out to someone in your group. Reach out to your leader. Reach out to a primary doctor you see. Please just reach out though, because depression. One thing when we talked about the negative thinking is your thinking will actually be lying to you, telling you that you're alone in this, and that's really, really, I promise, not the truth at all. Don't let your thinking lie to you. I really enjoyed talking about depression and just even this short spiel right now. So I would love to talk about it more or anything else. So I really thank you for inviting me to come. Again, I'm so sorry that I had to do a presentation from home. But thank you for the invite, and I look forward to in the future coming to a meeting and checking things out. So thank you. Please direct any questions to Susan, and if she is not able to answer it, maybe she can send me an email with some of the questions, and we'll go from there. Well, have a good night, everyone.